Okay, well, we'll give folks a few minutes to get themselves logged in, and I'll put out a quick reminder on Facebook for those who are watching online. But we'll do a quick sound check and a level check. So we'll do a quick roll call and a special shout out and thanks to Tiffany and through my house office for in here today. So Bill, why don't we quick sound level check with you, make sure we can hear you.
Okay. Hi, how are you?
Sounds loud and clear on my side. Vincent, you next.
Hello, good afternoon.
Sounding good as always. Barry? Barry, are you there? Yourself. There's always one. So, all right, Tiffany, you want to chime in? Your sound working?
Say that again, Rep Singer.
Okay, that was perfect. Just wanted to make sure the sound was still up and running. All right, we'll give it another couple of minutes, and but Isabel, you sound great. Vince, always sounding wonderful as always, and Barry will hopefully, when you get a second, we want to do a mic check, sound check with you as well. I'll give it another couple minutes for folks, and I will reshare. Oh, get.
Sounds promising. If you're getting an echo, that means maybe we should. Are you on now?
Oh, sounding.
Sound is a little loud.
You see me?
Yes.
All right. Well,
A red zipper top or something.
All right, Barry, let's do a quick sound check. Just make sure we can hear you without feedback.
okay. Sorry about that. I was struggling to help Bobby on, and he seems to be on now.
All right.
I don't know if you can. Looks like I see 29 participants. Do you have a? Can you bring Bob in another way, or?
So what we'll do, so Tiffany's our moderator here, and so we're going to get started in about a minute, actually.
Okay.
And what we'll do is we'll bring him in after everyone else has concluded speaking, if that makes sense, unless you want to bring in Bobby sooner.
Well, he has a story to tell about he was taking all the precautions and he tested positive and he got to the point where he was struggling and was in the hospital for 2 days. So it'd be interesting to hear how he was treated and what his experience was.
Okay, so why don't we do this then? Why don't we launch with Tiffany, if you can unmute Bobby, that would be great. And I don't know if him on your list, Tiffany.
He probably came in under an attendee, so hold on one second.
Yeah, and I didn't know how else to link him in.
All right, for everyone.
What's his last name?
Dresner, Robert Dresner.
Okay, I allowed him to talk.
Okay.
All right, Robert, do you want to quick and make sure we do a quick sound check, and then we'll get started.
Yes, I am unmuted.
You sound wonderful, and we can see your name loud and clear. All right.
So he's not video, he's just audio?
Mhm.
Okay.
All right. So for those of you who are just joining us, we are going to get started now. And so my thanks to everyone who has thus far. And I once again want to put in a special thank you to that we can all have a conversation. As chair of the Public Healthcare and Human Services Committee, I certainly can tell you that this is arguably one of the most stressful times for so many of us. If you haven't experienced a personal crisis, this is now a community epidemic that is feeling like a crisis, because it is for a lot of people. Whether you have anxieties about your job, anxieties about your parents who are aging, or your health. There's a lot going on, but we also have people, experts, and able to help walk us through this. And so what I wanted to do today is present people with options and opportunities that they might have. And so we've brought together policy experts as well as licensed clinicians who can have conversations with us in both English and Spanish about tips and tools about how we can all make sure that we're taking care of ourselves before we're doing anything else. And as a quick housekeeping, Barry, if you don't mind muting yourself until we have you come up and speak, that would be awesome. And so thank you, Barry. So with that, we actually do have someone else who has just gone through a really stressful time and wanted to share briefly his experiences dealing with COVID-19 and what's going on. And then what I'll do is I'll wrap things up after everyone else has concluded speaking, and then we'll allow an hour for Q&A from our watching audience. So I'd like to introduce Robert Dresden, who has just gone through something that a lot of us have to go through, but I think his experiences certainly warrant a public discussion. So, so Bobby, if you want to unmute yourself and take it away, and then we'll go to our other speakers.
I believe, can you hear me now?
We can hear you great.
Okay, so as of March 13th, the afternoon, I felt fine. It wasn't until that evening I was getting ready for bed. I'm on like a freight train. Intense body aches. Had some fever, and it was really over the top. And before I continue, Barry knows this. I spent many years in India. I'm familiar with being ill with some strange diseases and being alone with illnesses. And I've had the flu more than once. And these bodies that night and the next night were like nothing I've ever experienced before. I went over to the Boulder Medical Saturday, saw a doctor, tested negative for the flu. Lungs were clear, and she had said symptoms persist and/or I reach 102 temperature, I need to go directly to the ER. So that was Monday night. I went to the ER on Monday night here in Boulder, Foothills Hospital. Kept me for a couple hours, tested negative again for the flu, and at that point they were still testing in the ER for the virus. And they tested me, and I, continued to be self-quarantined. I mean, I began on Friday night. The next week, I didn't find out until Friday. It took 4 days to get a positive result. And it was almost a relief at that point, because I imagined it not being anything else and having to fear going through this again. But I really wasn't that sick yet. I would have these, I'd have temperature, I'd have bad chills, I had a touch of nausea, things like that. My lungs were clear. To say I was overly sickly, I would have hours where I felt pretty good. I had hours where temperature dropped. And I was hopeful that it would, maybe drawing to a close. there was very good follow-up by Boulder County Health and the hospital. Got in touch with me, I believe, on Saturday, and filed my symptoms for information, and cautioned me, which I knew from the media, that the second week could be much different than the first week. That people tend to either get better or much worse. I became much worse. Symptoms changed again. They would flow, disappear for a day, come back. Led to intense nausea, intense weakness, had no appetite whatsoever. I go into the emergency room. I have an underlying condition which is assailed, which is my digestive tract. Came home next morning. Next morning was the sickest I've ever felt in my life, and but this was the sickest I've ever felt in my life. I mean, I can't even describe it. Just so I went back into the hospital. They admitted me, filled me with fluids, anti-nauseants. Their enzymes were high in 2 places. Spent 2 days there. And when I left, I finally started to feel better. And I've been improving ever since. In fact, I've been, as of today at 5 o'clock, would be 72 hours without fever. I can only describe the infection as being dark and insidious. It does affect your thought patterns. It can affect your dream patterns in the way that hepatitis can do that. I've had hepatitis when I was. This was much worse. And the insidiousness is how the symptoms continue to recycle, and they come at you from different directions. And if you have a weakness in your body, whether it's me, digestive tract, heart things, I had some irregular heartbeats for 2 days, which I hadn't had in 10 years. Will attack anything in your. Telling Barry, I'm used to spending time alone, whether it's traveling alone, living alone. I'm an author, written a bunch of books, my desk alone, and being in the house now for 17 days was not that challenging for me. But I suspect that brutally challenging. It can be punishing for somebody that's not accustomed. And that's basically my experience with it. It's insidious. And I'm grateful I've had tremendous community support. Despite my Bronx accent, I've lived here for a very long time. And I know a lot of people. And it wasn't even it was just a matter of people calling and texting and emailing. It was helping to pass time because I couldn't focus on anything else. And then, of course, during the second week, I realized it was not a really good idea to watch TV anymore, especially any news about the virus. It was just a negative loop. And I'm grateful to start feeling well. I'm grateful for the support. I think the community in general, including Foothills Hospital and Boulder County Health, was surprisingly, not surprisingly, they were genuinely responsive and different. They checked to see who I was in touch with. There was one particular person they felt was at risk. Fortunately, that person didn't express symptoms. Followed up with him. And I'm grateful to be where I am.
We are grateful that you're here. And thank you for sharing that very personal. Do you have any words of advice or suggestions for other people before we go on with our panelists? And are you able to stay on for the duration of this? So
I will stay on another hour or so. I'm fine. And I think this is the more important thing because I would like to be available to people if they need to if they can speak with me in some way and feel encouraged. I believe that's the only way through this. And I'd like to share the support and pass it on. So whatever it is, answering a question or just having an idle conversation, I'm available.
All right. Well, before we go to questions, why don't we go to the remainder of our speakers? And I see there are questions coming in through the chat section. So I am watching that very carefully. And when of this, we'll do our best to get to the answers, and then we'll have the contact information listed. So if we don't get to your question today or don't get you a sufficient answer, we'll make sure that we address you when we can. And as you can hear, I'm going to do my best to turn off my notifications while we're doing this. All right, so with that being said, I want to introduce Vincent ATCHITY with Mental Health Colorado. Vincent has been an excellent advocate at the Colorado State House, as well as really across the world of criminal justice reform, previously with the Equitas Foundation, and the work he's doing now to make sure that mental health practitioners and patients are sufficiently advocated for in our process. So I'm going to let him speak, and then if Vincent, if you're watching the chat comments right now, I know there's a question about Medicaid that you may or may not want to answer right now, but I'll leave that up to you as you kick it off for us. But thank you again for joining us today.
Thank you, Representative Singer. Glad to be here with you all. And thanks for letting me go first. I mean, I'll just make a few remarks. As someone who's been working in the area of health integration for years, this particular crisis really drives the message home that our physical health and our mental health are not two separate things, but two sides of the very same coin, which is our health. When we have this global threat to our physical health, all of our mental health begins to react as a direct consequence of that. And a lot of the media work I've been doing over the course of the last few weeks has been addressing questions about, well, how do we manage our anxiety and stress faced with this threat and these uncertain times? And it's a real opportunity on one hand for everybody to have a bit deeper understanding of the extent to which mental health is something that all of us have and all of us share, and the mental health of one very much affects the mental health of another. You know, there's a lot to be concerned about with regard to people's stress and anxiety, and with regard to people's concern for their children and for their parents and for folks who have are in vulnerable conditions with regard to their health. I also am concerned for the folks for whom our organization has been advocating since we were founded in 1953. People who live with serious mental health conditions are often sort of segregated and forgotten by our communities. And we've had difficulties with regard to putting in place adequate levels of access to care for people with serious mental health conditions. We've had chronic shortages of supportive housing that would provide the wraparound services that might enable people to thrive rather than do poorly as they too often do. And much too often in Colorado and elsewhere in this country, we seem to default to crisis response that involves law enforcement and then an unfortunate pathway into the criminal justice system, so that here, as in other states in the country, we can say that jails and prisons are our largest psychiatric facilities. And all of this may seem irrelevant in the current crisis with this pandemic. But one of our concerns in faithfulness to the folks for whom we've been advocating is that we've been making good progress with these people over the course of the last several years, and very strong work in the legislature, for example, advancing different policy that would expand access to care and create additional opportunities for supportive housing and take serious steps to disentangle mental health and criminal justice. And one of my concerns in the current crisis is that these people are now been moved off the radar to some extent, or back out on the sidelines a little bit as all of us turn to the crisis. And I just want to put in this little 2 cents that we really remember that there are some extremely vulnerable people who are going to require the attention of their communities of support more than ever in this crisis. And it's important that we don't forget them.
All right. Well, Vincent, thank you so much for sharing that with us. Um, Next up, we have Isabel, and I'm hopefully I pronounce your name correctly here, Isabel Brones, and Isabel is a clinician with Mental Health Partners, our great community resource here in Boulder County. And Isabel's got actually some tips that we will repost on Facebook through some PDFs that you sent as well. But rather than have me talk about it, I'm going to let you take it away.
Thank you. So we are still available for services because we have moved to phone or through Zoom in our sessions. So that has been quite a challenge, but our population really needs us, particularly at this time. And we're trying to keep the most acute among our patients out of the emergency room, out of the hospitals. So we have prescription services available, and we are meeting we are triaging the clients that need most services and make sure that we reach out to them. And yes, we have tried to help with our tips on how to deal with the situation, and the things that we cannot control and the things that we can. And I'm the bilingual therapist in the Longmont office. So I have a few Spanish-speaking clients that I've been reaching out to and making sure they're okay, and with the instability of jobs and things like that. But our crisis services are open, and they're open in person, but we want you to call before you go. And that number is 844-493-TALK. And we're also open in our Sherman office, which is 834 South Sherman, and providing medication and injections to people that need it. And also, there's one more place that's open. TRT, which is the Transitional Treatment Services, which are for people with substance use problems, because of course those are at risk of relapsing at this time as well.
So Isabel, thank you for that. If you don't mind actually repeating some of that in Spanish, what we're going to try and do is cut that and repost that. And so for our monolingual Spanish population here in Boulder County across the state of Colorado. And then we're also going to reshare your forms that you've put in both English and Spanish. And so I know Tiffany will be going through those slides. So if you wouldn't mind just restating that, I would appreciate it.
Bueno, como no estamos todavía proveyendo servicios a nuestra clientela en español, nos pueden llamar al 303-443-8500 para hacer una cita, para primero una evaluación y después servicios. Pero también tenemos la oficina de crisis que está abierta, 844-493-8255. Por favor, llamen antes de ir, pero están disponibles. También tenemos la oficina en 834 Sherman, al sur de Sherman, abierta. Y cualquier cosa, por favor, llámenos por teléfono y vemos si las podemos hacer. I don't know if I said everything I said in English and Spanish, but I tried.
Well, you know what, I tell people, really you're trilingual. You can speak English, Spanish, and mental health language, which is its own language. So, so really you've got all three covered pretty well. Anything else, Isabel, that you wanted to share in terms of resources? Otherwise, we can go to Barry.
No, I think we're online. We have the three services that people that speak Spanish can reach out with the phone numbers, and they can share additional help.
Great. Well, thank you very much, Isabel, and we'll see if there are questions for you after we go to Barry. So Barry Erdman has his, actually, I forgot, you have your doctorate in social work. I should probably call you.
It's a diplomat, not a doctorate.
Okay, well, never mind. I won't call you Dr. Erdman then. So I'll just keep calling you Barry. Barry has been a remarkable individual clinician, but also has spent a fair amount of time in the world of advocacy as well. You can certainly see in the slide here some of his background and work, but has also worked with the National Association of Social Workers, who are practitioners who are on the ground doing the work right now. And so Barry, I'll cue it up, and I don't know if you can tell me what you're seeing in private practice right now, and what maybe helpful hints and tips you might have for people who are experiencing stress right now.
I have so much I would like to talk about, but thanks, Jonathan, for bringing me into this conversation. I just want to start by just generally laying out where we're at. And in my private practice, I just want to say that I see people who have major mental illness, and I see people who are disabled because I'm a Medicare provider. I see seniors and couples, and have been hearing different sides of the story. The most important thing I want to say is that, as Vincent already mentioned, we've never been in this place before, and yet in some ways we all are familiar with dealing with situations beyond our control. We all at this stage of the game have had trauma. We've all had some difficult times in our lives. So we can say without any question, we all have some resilience or lack thereof. We all have moments where we've dealt with depression and anxiety, some more than others. Right now, we've gone through what I kind of think of as those old Elizabeth Kubler-Ross stages, as a world, as a global society, not just in Boulder County, but the entire planet, which is just hard to comprehend. But you can imagine at first we were all going through denial. Oh, this isn't really happening. It's no big deal. I'm okay. It's not going to affect me. Then the anger stage of being outraged about how could our government have let us get to this point, or I can't believe we're being told we have to stay indoors. Then the bargaining stage, like, okay, well, we'll social distance for a while and see how it goes. Maybe by Easter it'll all be over and we can go back to the farmer's market and live happily ever after. And I think now we're in the stage of depression where many people are starting to feel the hopelessness and realizing that life may never be the same as we remembered it. And there's no vision of how the future is going to be right now, because it's all, we're just going day by day pretty much with the news cycle and how we feel and how we're managing or trying to anticipate managing with finances and family and so on. And as we continue here through the next few weeks of learning more about people we know who are tested positive, like Bobby, who I just saw in the paper this morning, I was saddened to hear, Bobby, that he was gone through this experience. But I think most all of us are going to start hearing in the next week or so of people we know who are ill and at various stages of health. And that puts us in the position of now saying, okay, where do we go from here? If things are continuing to escalate, what's the next phase or stage? And of course, we can say, well, we'll likely be hearing about more deaths and more tragedy and lack of supplies that we've been told on the news media. So somewhere through the depression phase of the Kubler-Ross model, we have to come to some acceptance to understand that this is really happening, and to learn what to do about it and how to cope and how to adapt, and what we can do now at this moment in our lives to do all that we can to find the resilience to be able to find new meaning in our lives. It's really an opportunity. That old Chinese phrase, crisis as opportunity. So here's our crisis, and if we allow ourselves to stop for a moment and take a deep breath and reassess what our needs are and what our priorities are now, and focus on what we can do in our circles of social circles or family circles, then we can begin to feel like we're making some efforts and making some progress towards regaining a sense of self-worth and feeling connected in the community. We've known for a long time about the mind-body connections, and now we have this physical and emotional. We think about how we're isolated physically and maybe going through some hard times like never before with increasing lack of contact. But it doesn't mean we have to stop the emotional contact. If anything else, right now, it's an important opportunity and priority to stay in connection with people, to allow for us to realize that we can get our emotional needs met, even though our physical needs may not be addressed right now in the way that it used to be. For example, going for a walk after this is over, but keeping distant from people. So with my folks, what am I seeing in my practice? There's some people who don't have an internet and don't even have a cell phone and don't even know what the recommendations and guidelines have been. So those of us in the front lines, we have I think, a responsibility to at least educate people and bring some balance to what the rumors are and what the fears are, and bring some information about what's the protocol here. What do we need to do? The simple things what we've been hearing, most of us have been hearing over and over again about washing hands and so on. So there's that educational piece, and then there's how to be able to take our attention away from the past and the future and bring it back to the present moment. If we've had past trauma, our nervous systems are going to be re-engaged, like post-traumatic stress kind of symptoms reemerge, and then the ability for us to cope and to deal and to find our way to manage is the same skill sets that we may have already been familiar with but forgotten about, in terms of finding some way to relax or to deal with anxiety issues. Nowadays, we have much more materials like online resources, meditation apps, and certainly these video conferences has been a big help. I can't imagine if we were going through this in an era where we didn't have phone service or we didn't have any of this internet. It would really be scary. So going backwards into the past doesn't really help a whole lot. It could re-traumatize ourselves because of past things we've gone through, and trying to anticipate what's up ahead and trying to problem solve before we know what the problems are is another way that people who have anxiety problems, anxiety disorder, get caught up in anticipatory anxiety, trying to solve what the future holds. And if you can't foresee an answer, then you begin to go into panic mode or begin to realize that you have no future if you can't figure out what the future is. So again, borrowing from Buddhism, it's really important to be able to stop and take a breath. From the AA 12-step model, we used to talk about one day at a time in terms of managing. Well, now I think it's 1 hour at a time. And if you're inclined to meditation, it's one breath at a time, to be able to say, okay, right now, what can I do to refocus my attention to something I am capable of doing? Is there something, if I'm helpless, if I'm feeling disconnected, how can I do something now that I love to do, that I've been putting off for years, projects that are still around that I've forgotten about? How can I reach out and call a few people who I haven't talked to? If you were having an anniversary or a birthday or a special occasion and you wanted to contact friends, this would be the time to do it, because you don't know how much it might mean to the person who's getting your call to hear from you. And so this is especially an important moment to be able to stay emotionally connected through any way we can possibly do. It's fun to watch all the creative internet videos of people singing opera on their decks, or an apartment house where everyone is doing a group dance or a group exercise class in their own apartments at the same time. Musicians who are playing together, performing together through through the technology. An important moment for us to stay connected, realize we can address if we. I have so much more to say, but I bet now.
No, thank you so much for what you said. And to our presenters, you didn't harmony at the end of this. Get your part for All You Need Is Love at the end. And everyone can log off because we have not practiced. So seriousness, thank you for tips. And I'm going to queue it up. Actually, before we go to questions, I saw there's someone here from the State Department of Human Services. And so I want to let Tiffany, if you can unmute Megan, Megan Lee from the Colorado Department of Human Services, and then Megan, I see you're unmuted. I don't know if you've seen in the chat, there is one question that's more of a question for Medicaid than it is for the Department of Human Services. But Megan, anything briefly share? Let us know what you've got.
Yeah, thank you. I oversee Colorado Crisis Services through the Department of Human Services Office of Behavioral Health. And just wanted to get on and let everyone know that Colorado Crisis Services is still up and running. There's still some allowable face-to-face interaction, the walk-in centers and mobile crisis units that can go directly to meet an individual who's experiencing a behavioral health crisis. And then of course, the statewide call, text, and chat line all Coloradans need. I'm happy to talk services may be somewhat modified outside of just a reminder that Colorado Services is here for you for whatever it is that you may experiencing. No crisis is too big or too small, and particularly the hotline and line, they've been fielding a lot of calls and texts about coronavirus and the community's response to it, and just how people can better take care of themselves and their loved ones this time. We also know that this time may bring up some past traumas and past challenges with substances and other issues, and Colorado Crisis Services to help support those sorts of things.
Well, and as you can see, we've actually just jumped to our last. This has the 24-hour text talk line for Colorado Crisis Services. Also, the other two that I wanted to share with everybody is our National Domestic Violence Hotline and also our Child Abuse Prevention Hotline. For those of you, so the crisis hotline, first of all, you can text or you can call 844-3TALK or 844-493-2. For the 273-TALK. 273-8255. You can also text talk to 38255. I know everyone who's just about a year and a half younger than me seems to be much more comfortable on the text than anyone else. Another thing is for folks who don't know this, child abuse numbers in terms of reports are going down, but that's not an indication that child abuse isn't happening. Really is probably an indication that it's actually just being underreported, because a huge number of our mandatory reporters are teachers who have contact with our kids. And so if you have a concern about a youth, please don't hesitate to make that phone call. Those phone calls are confidential. And caseworkers, God bless them, are still out there helping families right now in this pandemic. 1-844-CO-4-KIDS, 1-844-264-5437. There's also a website that you can go to. And also same thing for our National Domestic Violence Hotline. We know that if people were feeling trapped before they're feeling even more trapped right now because of this pandemic. So 1-800-799-7233, 1-800-799-7233. That's the National Domestic Violence Hotline. We're going to leave this slide up for a little while, and then repeat it. We have Colorado mental health partners, as well as have my phone number, policy questions, or you need to get in touch with services, whether it's unemployment or you name it. We do have a staff that are ready to help out, of a staff of volunteers that are ready to help out. So, so Megan, I apologized if I sort of jumped in there, give you a chance to say anything else. Was there anything else you wanted to add before we go to question?
No, and thank you for bringing the phone and text numbers up. Chat can also be accessed through the website. So thanks for putting that up, and I'm here and available for questions if anyone has anything specific to behavioral health crisis response.
Wonderful. So I'm going to go. I have to admit, I've been watching the Q&A section as well as that screen. So if people do have questions and want to type them in there, now is a great time to start out with this. I see. I'm going to go with the. Well, none of these are easy questions. I'm gonna go with the first question that I saw on the chat line, and this may be more of a Vincent question and a Megan question. So if Vincent and Megan, you want to unmute yourselves. This is from Andy, who says his families are pressed together. Couple therapy is graded, so can be better navigated. Both are Medicaid reimbursement for family therapy is dropped to less than $50. What can be done so this rate is at least equal to individual therapy rates? Also, this is once again more of a Medicaid question, so for this offline. When will Colorado healthcare policy and finance request a federal waiver so couple therapy is a covered benefit without an identified patient or diagnosis? I'm going to leave it at those top two questions. There's about 4 more in there. And if we have time, we're going to go back to the other 2. But Vincent or Megan, if you can respond to the reimbursement, what's going on with that, whether that's come across Mental Health Colorado's radar, we'll start with that one.
Hi, sure. This is Vincent from Mental Health Colorado. So these are very good questions. And before saying any more about that, I'm wondering whether Megan actually has a material answer to these questions. I do not. This is the first time that the disparity in reimbursement for couples therapy has been brought to my attention. If Megan doesn't have an answer, what I can say is that we have a monthly meeting with folks at the Department of Healthcare Policy and Financing, and that happens to be tomorrow. So I will raise these questions with those partners.
All right, Megan, anything else on your side? I know this is not Department of Human Service question as much as is a healthcare policy and finance question.
Yeah, unfortunately, I don't have an answer to questions about reimbursement. That is fully in healthcare policy and financing and not in my department.
Vincent, are you seeing this question in the chat? Because what I'm going to do is have you connect with Andrew after you meet with HCPF, if you're willing to forward those questions up to healthcare policy and finance.
Yes, I can see them.
Okay, great. Andy, I wish I could get you a better answer, but that's the answer I'm going to be able to give you today. And we're going to follow up with people via the phone numbers and emails that we've set out. Next question comes from Dr. Dawson. Says what is asking what for our kids. So in terms of what are we doing, I'll go with Barry and Isabel on this one. Are you seeing young clients right now? What suggestions do you have for parents who it may not be a mental health issue, but it's certainly, as someone with the age of 5 right now, been great to see them 24/7 that way. So, so what are you seeing? What are you hearing? What do you suggest? We'll start with Isabel.
Well, we do have services for and we start from 0 to 3, and then we go, until 8. So therapy is available for them, and the best thing is to talk to them and explain what's going on in their. There are a lot of resources that you can reach out to online, how it's about COVID, and it's not hide or things, just really as real as possible. But we have therapies that are working with children now, and also with pregnant women, and it is a very important population that is going through some stress at the moment. Our community infant program works with pregnant people and navigate through this crisis as well.
Okay. All right. Well, Barry, anything else you want to add?
I don't see young children in therapy. I see families, and I enjoy thinking about parenting concerns. What comes to mind right off the bat, just some practical sort of hints from Heloise kind of ideas, is if we are in a situation where you're in the house now more with your, this is a wonderful opportunity to have a relationship with them. Our culture, the way it's been up to now, is we really have been used to after school activities and putting kids in front of and we've managed in our own lifestyle to keep a safe distance from our kids. So here we are now with this dilemma of being in the house with kids. In the house, oftentimes the parents think, "Oh, the kids are driving me nuts." The kids are setting the the atmosphere. But actually, there's a mutual kind of a responsibility there. So first, parents is to consider what a new routine would be if you actually set a schedule. Kids have a different kind of time frame and a mindset for how they spend their activity time. So if there was a way to be able to start thinking about creating a schedule at home for when there's reading time, when there's TV time, when there's cooking, let's bake something together, let's prepare some food, let's do some house cleaning together. All of a sudden, you devote some time to different activities, create a schedule, and then have the kids participate in the schedule so they have ownership about what's going on. That way, the parents are not just kind of wearing down and getting emotionally stressed without any place to turn. With children, they may or may not understand what's going on with the virus and all of our concerns as adults. It's important to ask the kids what they heard, what a community develop the kind of supportive, nurturing, safety kind of relationship that the kids are needing. So it's another opportunity to show up and to be present with the kids and to be sensitive to what their needs are instead of our usual tactics of diversion and distraction and keeping them busy so you can try to get some things done. I'm more for letting them bang on pots and pans with wooden spoons while you're trying to cook dinner than setting them up with a video in the next room and ignoring them, and they're screened in and thinking that's normal. I'm happy to take more specific questions if people who are listening in or watching.
Barry, to limit the time that the kids are watching the news and what they see on TV, because as adults we're very stressed and we know everything that's going on and to be up to the moment. And it was, you know, I want to be watching TV 24 hours just to do things, but I realized that for kids, that's turn off all media and dedicate to play games with the children, spend time with them. There is a very nice, you know, everybody has Candyland. There is a feelings Candyland that you can use and learn about feelings while you're playing it. So try to incorporate that.
Excellent. All right. And I do see you for sharing the link on synergetic play therapy from the Synergetic Play Therapy Institute. When we post this on Facebook, we will upload that to the links to Facebook. And if anyone else has any links that they wish to have posted, just let me know. Speaking of links, I see there's a question here. What is the phone number for Bell? I think if you don't know this one,
443-8500. And there are people answering the phones, and we haven't seen an increase in calls or visits to the crisis center so far, but I think that that's something that might change. There may be a wait to get services, maybe a couple of weeks or something like that, but yeah, that's the phone number to start the process.
great. All right. I'm just going through and looking through other questions that might be coming up. And as we're going through this, yeah, I'm gonna leave these Medicaid questions for Vincent to put out there. That is there anything that we're missing that we're not talking about or haven't focused on that you think would be helpful for other people to know, given our situation right now?
I'll just join the conversation in terms of resources representing the private practice sector outside of the agencies. If people are needing support, there's other ways to identify which therapists are doing online and video conferencing and are open to taking new clients. So there are 2 resources that I'll just mention that can be added to the list, which is psychologytoday.com, find a therapist. They just added a new section so therapists can identify who's doing video conferencing. And so I think that's an important way for people to test a database of therapists who may be available. The other one that Psychology Today is called helppro.com, which is another resource for finding therapists who are doing online therapy. And there are many, many others locally and nationally that keep databases of therapists. But I think we're entering this moment in history where face-to-face therapy may not be ever the same. And we may go for many months now relying on this technology to help in any which way we can. And then using mental health partners as our local access point for crises and services that have more immediacy. That being said, there are plenty of people who just need someone to talk to and are feeling disconnected in our nursing homes that are in lockdown now because there's threat to the virus, the institutions. People are limited in terms of who they work with, and now visitors are restricted. And it's very important that we encourage people to reach out and call and know that there is someone who is available to listen. So I'm imagining we're going to see the numbers increase, Isabel. If there's no immediate rise that follows the curve of the virus, I think follow the curve.
Yes, I think so. Yes, another thing that's important to keep in mind what opportunity this crisis gives us and what kind of person we want to be. We go from an area of fear to an area of growth. So do we want to be the people that are hoarding toilet paper or supplies, or do we want to go to people to be people who share our desire to help others and be positive and try to guide people through this crisis? So keeping in mind our values is also important at this time.
So I just had to unmute myself because I realized that Republicans always appreciate actually at the Capitol. So I'm going to just move to a very brief legislative update because I know that people are wondering what are the elected officials actually doing right now. So the legislature has recessed for the time being. In the meantime, we are looking at remote options in terms of voting, in terms of testimony. Every bill that's introduced gets a public hearing. What that means in the time of COVID-19 is something that we still need to work out. And we have recessed for the time being. We will likely are set to come back tomorrow to see whether or not we will extend that recess for another period of time, because we do not want to encourage large mass gatherings of people physically. That being said, you know, I've actually been talking and texting with my House colleagues. We have been working day and night with our state and federal partners to be able to secure the financial relief that is now being provided through a $2 trillion relief package at the federal level. That is, unfortunately and fortunately, I will say, the beginning of a conversation. I know that the federal government is looking at coming back again to see what other issues need to be addressed. Some of the big ones, I'll just give highlights right now, are additional unemployment coverage and assistance for people who are contract workers or are in our economy. That has been a huge issue and something that will be addressed through the federal relief package. I think most people have already heard that individuals will probably be getting up to a $1,200 federal relief or federal money, and then another $500 per dependent child. So there are some options out there, but there's a lot of questions that are still on the table. I know we need to make sure that renters are protected, that people who have mortgages but can't yet make those because they have lost their jobs are also getting the services that they need and getting the dollars that they need without being foreclosed on or evicted. And that asks a lot of very large, broad policy questions, but it is something that I personally am working on. I see another question here from Faith, who asks, I have questions about the mental health needs of families who have children with special needs. Without the support of schools and the possible decrease of in-home therapy, what's available to families who have children with special needs? Anyone who wants to hop in on that one, that is an excellent question.
I was trying to look online. You can always contact Imagine, and I'm just, my internet is, they have coronavirus information pages, and they may have some resources there, and you can always call them and get some information from them.
Great. And Faith, what we'll do is we will try and connect you with we'll try and connect you with that. Chris, oh, my screen is jumping around right now. So also, anyone in the chat section, if they would like to be unmuted to ask a question live, I don't want to just have this moderated. So if people would like to be unmuted to ask their questions, you can either raise your hand, and I'm watching the attendees list right now, or you can or you can type a question and say, could you please this question live? I don't want to bottleneck here. Have these great experts. So Chris is asking, no one seems to be talking about how mental health issues contribute to vulnerability to COVID-19. So great point there. What are some other thoughts or recommendations to how we can take care of ourselves, understanding that mental and physical health are linked? They are together. We've heard about a couple of things, but does anyone want to sort of elaborate on the fact that your mental health contributes or takes away from your physical health? Barry?
Well, I think we all know that our immune system, the strength of our immune system depends on our overall general well-being, and that has to do with getting good sleep, eating nutritious food, getting some exercise as the basics. When it comes to emotional stress and anxiety that escalates, it does have a direct impact on our ability to fight off any kind of compromise in our health system. So you could say that anything we do in our mental health also supports our physical immunity. That being said, we have no cure for this virus that's going around, but we certainly want to keep ourselves as physically fit and as mentally and emotionally fit as we can. So part of that package of things that we do have some say over has to do with how we think, our cognitive abilities. And it's so easy to get caught up from watching the news and beginning to worry about things that we forget that we have an internal remote control where we can redirect our attention and our thoughts to something that brings a different sense of well-being. So, you know, we all have heard about maintaining an attitude of gratitude. If we begin to just look at the simpler things that we have, if we don't have freedom to have social events, we do have other things within our domain that we can appreciate. And sometimes we forget and overlook the basics that we may have to help us calm our homeostasis, our physical, mental, emotional well-being. Anybody want to add to that?
All right, Barry, I think Vincent, go ahead.
You know, I would just say that another way that mental health can contribute to vulnerability to the virus is just that this new regime of personal hygiene that we have quickly adapted to requires a whole lot of attentiveness to detail as we go through a day and make our way into the essential businesses like grocery stores and things like that. And maintaining those kinds of personal distances. And folks who are living with a serious mental health condition may have a hard time maintaining that extra level of vigilance around personal hygiene, and that may make them more vulnerable. And there's a significant tie often between mental health and homelessness, and folks who are experiencing homelessness are particularly vulnerable to infection due to basically the conditions of their life. And so there's that. And then I guess I would just say that as Barry was making that observation about the cognitive ability, our mental health also does better to the extent to which we are able to distinguish between science-based fact and myth and false information. And so if we are listening to the wrong sources of information and are unable to recognize credible authority when it comes to medical recommendations and science-based recommendations around our behavior, that is a kind of mental health disorder which makes us gravely vulnerable to infection.
I also want to add about substance use, that in these times, you know, people could just relapse. But there are lots of resources online for groups online. If you go to SAMHSA, the government site, they have links to those. So that's another resource.
Great. So there's another question that came up here for people who have links to articles about children for later reading. You can email this to me, repsinger@gmail.com. You can also link up to the Facebook page. You can send it to us in chat or via the Q&A section. I'm looking for hands that are raised, and I'm not seeing too many, which means either you're watching with just absolute engagement or are all sleeping and we have you on mute. But Barry, anything else?
I'll raise a question to you, Jonathan.
Yeah.
I've watched on the national media these government folks that come into Crisis City and look for structures where they can build temporary hospital hotels that are being vacant, or dormitories, school dormitories. It got me thinking about our hospital on Broadway that's just sitting there that now the city owns. If we ever were needing more space, the hospital is running out of resources. Has that ever been discussed about utilizing the old hospital on Broadway?
Absolutely. So actually, I spoke with the hospital actually about 2 weeks ago, and what I would say with the hospital situation is that the vacated hospital right now has likely at this point been so gutted that there are probably no actual services that or machines that we'd be able to hook up to easily. So our oxygenators, things like that. That would create just one problem. The other thing is making sure that we have the structural integrity and to actually make sure that it's a safe place for anyone to be in right now. So the state is taking an inventory right now. I've had some informal conversations with the city of Longmont and Boulder County about taking inventory of what buildings, what places would be safe places if we need to build out. Also, because of the acceptance of the disaster declaration, we're able to activate things like the National Guard, which is helping with logistics right now, and also a strong likelihood of the Army Corps of Engineers being able to assist as well. The short answer is no. It's probably not a good idea. Also, Dr. Dawson just wrote in, said Boulder Community Hospital says they're actually in pretty good shape right now for what they need to do, which is a good thing for everyone to take away some hopeful nuggets of wisdom there as well. So thank you, Pete, for staying on the line here with us.
I can throw out another question.
Yeah.
Maybe to Isabel or Vincent. I've had a number of people approach me saying, I'm available, I'd like to volunteer. I'm a retired therapist. I have a few hours, I'm home doing nothing. I could be a support to somebody, but I don't know who to call. I've had other people who are not therapists who are saying, I'd like to help, I'd like to do something, but I don't know what to do. So I'd like to open up that question to anybody, even people who are on the chat. What ideas do we have? This is a time for us all to be creative and to think about how to reach out and to feel good because you're helping others.
I just read that in New York, they started a hotline for mental health, and people are volunteering. So I don't know if somebody could organize such a thing. Maybe you, Jonathan, I don't know.
I'm going to jump in real quick right now. If anyone out there wants to help out, and I've already filled this out as well, the state of Colorado has a website, Help Colorado Now. And if you go to helpcoloradonow.org, it gives you a pretty extensive volunteer sign up that talks about what opportunities are out there. If you're a lawyer, if you're a doctor, if you, I don't know, I mean, not to be flippant about it, but if you're an expert at digging ditches, if you were doing a good job with, construction abilities, You're able to specify what services you're able to do. You sign up by zip code, so they know where you can help. But I would recommend for anyone out there who wants to help out. I also see from Lynn, you were saying that they're volunteering at A Precious Child in Broomfield. They need help right now. They're also on helpcolorado.org. But A Precious Child, wonderful group out in Broomfield. And if they need help, it sounds like, I'll just say it sounds like you can get to them through their website. So if anybody else has ideas about how to help out, I think that's actually, when we talk about loss of our own locus of control and getting some of that back, if you're able to volunteer and still stay healthy, this is an opportunity to participate in this. Any other questions for anybody here? Oh, and I'm hearing from Karen. Karen, always good to hear from you. They've organized a support group in Netherlands that will do deliveries, pickups, snow plowing, and phone calls. Oh gosh, I'm gonna butcher this last name, Karen, but Claudia Schaffler is the contact person through the Netherlands Area Community Support Coronavirus Facebook group. That was a mouthful. I'm gonna say that one more time for our folks out in NED. The Netherlands Area Community Support Coronavirus Facebook group. There is a group out there that is helping with snow removal, phone calls, pickups, deliveries. So our mountain community is always stepping up and helping each other out in many different ways. And so, Karen, if you have a link that you would like us to post here, feel free to share that. We'll make sure that gets put up on, once again, on the Facebook event page after the conclusion of the Zoom chat, which we're about 15 minutes away from. Any other thoughts or questions from?
I'm imagining nextdoor.com would be another resource for people to offer services and skills and also ask for help.
I imagine so as well, actually. So anything else out there from folks? I'm just going through our Q&A list right now and trying to make sure that we have everything available. I will just ask our panelists if there are additional questions after today. Just want to make sure it's okay that I can reach back out to you and be able to get folks the answers to questions that they may have after the Facebook event today. We're all getting head nods, so I'm going to assume that everyone is okay with that.
Yeah, absolutely.
Including plowing the snow plows, right? No. So no, I'm actually just reminded of this quote, and this may be a concluding remark unless we see any other things. Oh, yep. Susie, our council member, Susie Hidalgo Faring, said it is helpcoloradonow.org, not helpcolorado.org. So thank you for the clarification there. There's an old Viktor Frankl quote that says, an abnormal reaction to an abnormal situation is normal behavior. And we are certainly in an abnormal situation right now. And so if people are feeling off or feeling like they just aren't themselves right now, that is the right response to be having to this kind of situation. And so as we work through this together, don't forget that you've got a lot of other folks who are in your corner. They may be just one text message or phone call away. Any other concluding thoughts or remarks from our panelists? And Vincent, why don't you jump in first?
Sure. One of the things it's unique about this situation, unlike other crises that we've experienced before, like a hurricane, we can see it on the weather maps and we see it coming. And when it hits, it's devastating, and we know that there's going to be loss of life and property. But then we also know that in 5 days or so, the cloud system has moved past, and there's a window on the other side. And then the unique challenge with this is that we do not have a clear sense of certainty with regard to the exit plan for this. And so it really does challenge our mental health in a unique way. And this may be a longer rather than a shorter haul. And so it's really good that everybody, on this call and participating in this is thinking now. Everybody should be thinking about, well, how do we endure this for more time than we are going to be comfortable with enduring? And, with our kids, we've been using analogies like, imagine crossing the Atlantic on the Mayflower. It took a long time and people were confined in close quarters and the food was bad and you couldn't get away. Or imagine that fellow Scott Kelly, who's the astronaut who spent the longest amount of time on the International Space Station with something like over a year up there in a tin can floating around. So we need to draw on all kinds of unique different experiences to try and prepare ourselves for a endurance. This is a marathon type experience. So.
Isabel, any closing thoughts?
I was thinking of Winston Churchill's quote, when you're going through hell, keep going. But I also see here that Robert has a statement that is practical and scary. I was wondering what that statement is in the chat.
Okay, Robert, we'll go to you. Make sure you're unmuted and go for it.
Can you hear me?
Yes.
All right, so I've been holding this back. I know somebody who most likely has the virus who went shopping yesterday. Went with a mask and gloves. It's insane. 9 out of 10 people will listen and take guidance. 1 out of 10 won't. One of the guidelines I got from Boulder Health was, in about a half hour, I'm going to take my temperature. If it's normal, I would have reached the 72-hour limit where they say I'm theoretically free to leave the house and theoretically virus-free. It's not true. It's false information. Some people are free. I may shed this virus for another 2 weeks. And I have to use my common sense to continue to wear gloves and masks, not engage people. If and when I do go out, I'm still going to have people shop for me. Maybe I'll take a walk around North Boulder Park. The greater problem I see, I'm just talking about spreading the virus now, not mental health issues. Well, it's a mental health issue if you're nuts enough to go out shopping with the virus, which somebody who's very well educated should know better. How do you reach that 10th person? Because 9 out of 10 will listen. There may not be an answer to this, but from my experience, that 10th person is the one that screws everything up. And if somebody could find a way to reach that 10th person, whoever that is in whatever community they're living, because they're out there and they won't listen.
Well, Robert, I think I think Juan sharing your story, and Isabel, looks like you've got something to say as well.
I got something to say. We cannot control what other people do, and that's something that's hard to accept. But we can control what we do. So we can control wearing a mask or disinfecting our groceries when we get home, and just focus on what's under our control. Otherwise, it is really difficult. I agree with Bobby that many people are not following the guidelines. But when what we have control over, we can do something about it.
I agree. I'm just telling you, at the moment, what I see is out there.
Yeah, I know. I've seen it too.
And I don't know that the 10th person can ever be reached.
Yeah, that's true.
Jonathan, if we see someone who is practicing risky, threatening virus behavior, is there some way to report that? Is that a police matter?
So this is an interesting, it may not be because the person was never tested positive. So I can't see what the legal recourse is going through because they never had the test, except they.
Robert, if we see a group of people, young teenagers or folks that are partying on the street or not keeping distance.
Yeah. No,
Yeah, no, I mean, I think what I'll do is, first of all, after seeing the response from the last two town halls here, we're getting more people showing up to these than my physical in-person town halls, which either says something about my own personal hygiene or maybe just everyone else's interest right now. And so I'm going to keep doing these on as close to a weekly basis as possible. We did one just at the beginning of the week on for employees and small businesses. We're going to work on, we're taking feedback on what people would like to hear in terms of the next one. So anything that is a little bit of a deviation from the conversation today, I'll bring up there. Robert's point, I mean, I think, Robert, the power in what you were saying right now, and back to Isabel's point, we cannot control everyone's actions. We cannot, we are not going to have people just abjectly arrested and taken into custody. But this is about, one is this is a public health response. Just like we work on herd immunity, if we can make sure that the overwhelming majority of people are staying at home especially when they're sick, but everyone else is staying at home too, because we don't know who's a carrier and who isn't a carrier. That is going to be the best thing. And prevailing on people, we don't know what that is for that 10th person. Whether it's sharing your own personal horrific experience with this and getting someone's empathy there. If you don't know someone who's been affected by this, by virtue of all of us being on this panel, you're hearing someone who has been affected by this. Really prevailing on people's empathy for these situations and saying, it's me today, but it could be you or your kid or your parents the next time. These are all really helpful things. There is no silver bullet solution for that, Robert, and I wish there was. But I do think that sharing those stories is incredibly powerful. Go ahead.
No, it's just letting you know, from my limited experience, what's out there, because I'm hypersensitive to it, obviously.
And if we do see groups of people violating the stay-at-home order, don't hesitate to reach out to local public health or law enforcement. And law enforcement, the first thing they're going to do is prevail upon people's common sense for a second. So if you see restaurants that are allowing people to sit down and eat there, if you see people violating that stay-at-home order, don't hesitate to, if you don't feel comfortable responding to that situation yourself, your safety is important. Make sure that you do call law enforcement. That is from the governor. So if you do see groups of people violating this and they are not at an essential activity, please reach out. We'll do our best to educate people. I don't want to end on a sour note there, but I do want to say that I do appreciate everyone taking the time to be here on a Sunday afternoon. We are going to continue to work on these different issues and items. I know one of the other things that I've taken away from this conversation is, just as we are working to make sure that we are covering the healthcare needs of people with COVID-19, that will make sure that extends to the mental health care needs as well. I'm going to wrap up a couple minutes early unless anyone else has anything they want to add. Vincent, Megan, Isabel, you're more than welcome to throw in, give your last word as well. Otherwise, you can just say thank you and wave.
Thanks so much for having us on. And please do reach out. As I said, no crisis is too big or too small. Please reach out for support. Colorado Crisis Services is here for you.
Thank you, Megan.
Thank you for doing this, Jonathan.
Jonathan, I'm a big fan. I'm sorry.
Thanks for doing this, and thanks for having me.
Jonathan, I think you're right on the mark here about keeping the public dialogue going, and by doing these virtual town halls, it fulfills a need, and I'm imagining the need will get greater, that we all need to stay connected in a variety of ways. So I commend you for all the service and the work that you're doing.
All right, well, thank you, Barry. That's a great way to end this. So, all right. Well, unless anyone, I'm going to log myself off. I will keep watching the comments and questions. Once again, don't hesitate to reach out. We'll put up that last slide one last time, Tiffany, for people who want to contact and reach out to any of the organizations that we put out there, including myself. Once again, we'll leave that up for about 15 seconds or so, and we'll keep running through this. And you know, in the era of social distancing, I have to say I've never felt more socially connected with so many people. And so I want to thank you all for being here, being in attendance, and your engagement. And with that, we'll log off.